I'm seeing a
So
question
make
here
again.
from Devin as well, and he's asking, most patients at my practice expect quick fix dentistry, quick cleanup and x-rays. I feel overwhelmed by all the signs of instability I see and feel that I need to do complete exams for everyone. But it's hard to convince them of the need for it when they just want a cleaning and fillings. I try splitting the exam and doing photos to show them why we need a complete exam, and then book a second visit for the full thing. Any suggestions? Well, first of all, I will say that once you've learned what to look for, I mean, you see so much more. It's absolutely true. I'd say that far more than 50% of the patients, if not probably 60 or 70% of the patients, have signs of occlusal instability. The nice thing is that it's not a race. We don't have to get to the finish line and get all of the patients through a complete exam by a certain point. As I was saying earlier, I think we started off the evening talking about the fact that we plant seeds. And so when I first started seeing all these patients in my practice, I did feel kind of the same way for the first week or so, just saying, oh my God, there's so much. But then you realize that you're not going to solve everybody within the next few weeks. You don't have the time to do it. So you just start talking about it with your patients. There will be patients in the course of an entire day. You might have one patient that is interested in more information. So you don't have to force them into anything. There's going to naturally be people that want to go into the records and the exam process. So I don't force anybody into it. There are people who take, we could use, in my office we used to call it, they would go over the rainbow. And the over the rainbow concept is that it takes them a while to get to that aha moment that finally says to themselves, oh my God, I understand what you're talking about. What can we do about it? And for some patients, that's literally the 5 minutes in a hygiene visit. For some, it's a couple of years, or they might have to have some sort of debilitating event. But we talk about it and show them those signs of problems, and when they're willing to go further, then we take them into the exam.
Well, the other thing to think about this is that most patients, they just don't know any better. You know, that standard of care is their standard of care because that's all they've ever been subjected to their entire career as being a patient. And, you know, the way to really change that is just to start to ask our patients questions. So when you have a patient that's got 4 crowns in there, they need another one, and 3 of those crowns already have broken porcelain on them, just ask the patient, does it concern you that you've had 4 crowns placed in your mouth and 3 of them are already broken? And they're going to probably say yes, because nobody likes to have stuff break in their mouth. And that opens the door. We can say, well, is now a good time for us to talk about why that happens? And if they say no, well, then stop. And if they say yes, then they've just given you permission to open up that dialogue about what's going on in there. So, you know, asking the patients, you know, you'll start to see patients when they have signs of instability in their dentition, when they have wear, migration, mobility. And and these patients invariably have occlusal muscular problems. They have headaches. They have temporalis headaches. They have the back of their neck is sore. You know, you start to palpate their muscles and they got big knots in their masseter. And, you know, you palpate the temporalis muscle and you got to pull them back down from the ceiling because it's so tender. And those are moments to where you say, wow, you can act surprised. Wow, geez, wow, those are really sensitive. You know they're not supposed to be that tender, right? And they say, they aren't? Well, no. And again, they just open the door for you to start to explain a higher level of care to them. You know, in 16 years I've been in practice, I've only seen 4 patients die from not being in centric relation. And in the grand scheme of things, that's really not that bad. No, I'm kidding. So, you know, the good news is that I haven't seen anybody die from not being in centric relation. So, you know, we don't have to save the world in one day or even in 1 year. And so if you have a busy practice that it's already been kind of set up to be kind of that quick fix type of dentistry, it's going to take a little bit of time to transition that. And, you know, do you have time to give everybody a complete examination? You don't. So you got to start with the patients that are motivated and the patients that are interested, and then, you know, you start there and you start to build progress and motivation. You start to have nice before and afters on the wall in your office. You start to have testimonials from patients, and people get it. They will start to get it. But if all they've been subjected to is kind of a quick standard of care, then it's, you know, it's your job to start to build those bridges for them to be able to kind of cross over to the other side. But very great question, very common question, and, you know, again, Raj and I, our practices, I mean, we still have a lot of general dentistry patients in our practices. And so, it's a battle with them too. I mean, you can't, Rome wasn't built in a day. It takes time.